Welcome to our webinar, Digital Solutions for Now and Post the Crisis. In the current crisis, sparked by such a small virus, digital solutions emerge as a powerful means to cope with the situation. But furthermore, the crisis evokes thinking, or even more forces us to think beyond the crisis, about more general improvement of the business setup with digital capabilities. In this webinar, we are going to give insights what we experience today as T-Systems in terms of business continuity for our clients and the fast realization of new Corona-related services. But we also want to look ahead. What can we learn for the future from this crisis? We will outline the today and the tomorrow from three perspectives. Our first perspective is healthcare services presented by Mark Düsener, then followed by Dirk Backofen presenting security, and Frank Strecker is contributing the public cloud perspective.
So what I want to do today is give you an idea and an overview of how we as healthcare solutions see the digitalization process in healthcare developing in total, and how the Corona crisis is supporting or is even improving and speeding up this process, and how we can support there. Let me quickly introduce myself. So my name is Mark Düsener. I'm the Managing Director of Deutsche Telekom Healthcare and Security Solutions, a daughter company of T-Systems. And I'm responsible for managing our healthcare propositions in total. So who are we as Deutsche Telekom Healthcare Solutions? We have, although you might not have heard about us so far, we are there for more than 40 years right now. So Deutsche Telekom is active in the healthcare sector for more than 40 years, and we still have customers right from the beginning. We operate many hospitals worldwide, 230 roughly in Germany and 350 worldwide. So we do have our own hospital information systems. We do a lot of SAP implementations worldwide for hospitals. We manage 4 million patient accountings roughly per quarter. We are one of the telematic infrastructure providers in Germany that started last year. We've been one of the first telehealth providers, starting with research in Germany many years ago, and supporting the legislation to demonstrate the benefits of telehealth solutions, leading now to different legislation processes, which I will come across later during this presentation. I think one interesting aspect that's on this slide, which I'd like to mention because it already refers to the Corona crisis, is a couple of years ago we developed an app called Sea Hero Quest that was meant to support dementia research. So it was a game where you had to navigate a ship and so on, and the plan was to achieve 100,000 downloads. In the end, we came up with more than 4 million app downloads, and I think what's even more impressive, we had an average rating close to 5, so 4.9, with I think about 80,000 comments on that one. And one of the main comments were, we want to support research, and we therefore are willing and want to participate in that program. So how does that relate to what is important right now? It shows that the users in general are willing to support the system in order to improve healthcare, which I think is very important to mention and to keep in mind when talking about apps supporting the Corona crisis today. In total, the team consists of more than 700 specialists with all kinds of knowledge and experience, ranging from classical computer science up to physicians, nurses, and healthcare specialists. So It works. Looking at Germany as a healthcare sector, we see a two-sided thing. On the one hand side, and I think that's that's becoming more and more obvious in the Corona crisis, we have an excellent healthcare system. We are world-class, leading world-class when it comes to medical support, when it comes to hospitals, how they are equipped, and so on and so forth. But in the same time, and that becomes evident in certain areas as well, we are really low class in digitalization. It hasn't been pushed in the last years until recently, and therefore, for example, we still have communication means that are fax driven even today within Corona. We didn't have much patient integration via apps so far. We didn't have really, really mobile usage, for example, in hospitals and so on and so forth. So there is something where we can, let's say, where we need to keep the pace compared to the medical supply, where we are world class. Looking into what happened in the last years, we do see that although we started low, or we start low, the slide changes. There is quite a momentum that have been there even before the Corona crisis. So in the past, as I've said, it's been a long way and a slow way that we moved towards digitalization. And all means on the customer side, on the supplier side, as well as on the legislation side. But recently, in the last 2 to 3 years, this shifted dramatically. So the current politicians really pushed for digitalization, and what we can see, the customers follow that as well. So we had a lifted ban of remote diagnostics, or a lifted ban on cloud computing. The introduction of the electronic patient file record. What you see on the healthcare, on the customer side, hackathons, so agile working, agile integration of customers and suppliers. We even see tenders where an innovation management approach is a crucial part of the tender, although it's more about IT outsourcing. So quite a change, quite a mindset change. Very supportive legislation that is driving that. So what are the evidences that I see appearing more and more during now the Corona response, and how does that impact or act as a catalyst for digitalization? What we do see, and I think that's common among all of us, most likely in the call, is there's an increasing need for data among the healthcare system for research as well as crisis management. I don't know how often you do it, but a lot of people at least look once a day into the numbers. So how many people are infected, how many people died, and so on and so forth. Critical part of our daily life now. And moving forward, opening up the lockdowns, we will need even more data in order to be able to track and trace the consequences of the lifted bans, and in order to be able to manage it correctly, balance the healthcare part with the economic part and the personal freedom part. So that is a changing part that hasn't been that obvious and that public in the past. We do see an active integration of the patient or of the users. As I mentioned before, there's a lot of openness among all of us, and we're now seeing a strong amplification of healthcare in the context of Corona. What we haven't seen that dramatic in Germany, but more dramatic in other areas, is the need for mitigation strategies to enable IT business continuity in hospitals. Still today, many hospitals run their own IT, which is fine. But once the IT teams, which are often not that big, become ill, very simple in that Corona crisis. The mitigation isn't that simple because it wasn't planned for that. So this will change the world over time. And last but not least, we saw a drastic and dramatic increase in remote counseling of patients. First of all, to increase efficiency, and secondly, to secure the endangered groups, so avoid infection risks by being at the doctor's office. So the consequences out of that are kind of trivial even. So the need for data will definitely shows that we see a rise of public health. So the ministries and so on, they are not only now setting the circumstances and around healthcare, but they become an active player in managing, for example, this pandemic crisis. We see a push for open interfaces and standards among IT systems. Something that's very typical in healthcare, and not only in Germany, is that we have very monolithic, very silo-based IT landscapes. So having a hospital information system from a vendor A versus from a vendor B, the transformation or the change from one to the other is quite an effort because the data structures, the interfaces don't exist. And that was part of the economy in the past. The need for public data does change that. Something that already started before, to be honest, but now the push is even bigger. As I've said, we see the spread and rise of healthcare apps. I think even that was supported and prepared by legislation early on. You might be aware that we now have the right to get a therapeutic app by prescription in Germany. So there's a very quick introduction process that allows to prescribe an app and get the app paid by the insurance companies, which is really changing the ecosystem in that area as well. Cloud usage, I think, is one way to support a mitigation strategy. We do have, that's very German specific with our federal state system. We saw the need to get a better harmonization on data protection rules and authorities. That has been driven in the last weeks. And as I've said, telehealth and integrated care has dramatically started, and it won't go away anymore. So what does that mean for us as Deutsche Telekom Healthcare Solutions? Looking at our, let's say, 3 families of portfolio that we are offering. IMED1 is our clinical information system, hospital information system. We are already and will further push for mobile. So having the information system on an iPad, as you can see in the picture underneath, is crucial in order to, first of all, scale. So in the current crisis, getting new doctors on board, having a new location, this would help. But even better and even more, really making the hospital information system not a hinderer, but really a supporting environment in order to dramatically increase the efficiency of the processes within a hospital. Integrate the patient into the flow by providing a patient app, which we're already doing. Move our IMED1 into the cloud in order to support different operation models. Increase the number of data that we are integrating. For example, in South Africa, we are rolling out 52 hospitals, and there we are integrating the data of every medical device that you can think of. So a doctor having an iPad like this one, being maybe even on holidays, is able to see all the data that he would see when standing close to an ICU bed, for example. And last but not least, there is a push and there is a movement towards integrated care, meaning, for example, if I'm having a heart attack, after my hospital therapy, I would then enter into an integrated care program that will be supported still via the hospital and the doctor next to within my neighborhood, using means of telemedicine, telehealth, and video consulting. Coming to that point, that's our second family, the Telehealth 360. 360 because it's a package that is not focusing on a single stream, but really supporting it from a complete angle. Integrating telehealth means like video counseling, video consultation, but also case files. So the ability to have a patient case file on which a doctor as well as a hospital can work upon at the same time, in order to enable integrated care, which I talked about earlier on, and enable the ecosystem and platform for apps. In Germany, it's called digitale Gesundheitsanwendung, so digital health applications. So there we do see a need that, although there are a lot of ideas, brilliant ideas, often these startups don't have the capabilities, the know and experience to really move into the healthcare environment, which is quite complex with its rules, with data protection rules and certification rules. So enabling them by offering, first of all, a platform that they can operate their applications upon in a secure and certified manner. And secondly, offering them support and management consulting. So getting the contracts done with the insurances. This is something we envision here. Last but not least, telematic infrastructure. We rolled that out together with our competitors last year. Moving forward, what we do see is a move from hardware-based connectors, that's how they're called, to a software-based telematic infrastructure, starting with the patient to enable the virtual insurance cards that, for example, are very helpful, if not even necessary in telehealth applications, because how can you really bill if you don't, if you're not really able to authenticate the patient? And therefore move to mobile, that's the last point. So really putting that for the patient as well for the doctors on mobile devices to, for example, grant and gain access to the electronic patient file that is being rolled out from next year on. So last but not least, what are we doing in the Corona crisis context? We started early on with a couple of applications, for example, a test app that pushes notifications to you on your test results from the labs, increasing the process of that communication part. We supported the RKI in their application on a data gift from fitness trackers. Right now, very recently, since this week, together with SAP, we are the development partners of the government to develop the contact tracing application. We're supporting telehealth for elderly care homes, a very special group that is highly endangered. More than half of the deaths are living in a care home in Germany. We are developing a dynamic dashboard and analytics platform, so really supporting the public health approach, gathering all kinds of data that are necessary in order to really have a clear view on the actual status of the crisis, as well as being able to prognose certain impacts when changing lockdowns and so on. And therefore react on that, have early warnings and identify possibilities. Obviously, we are supporting our customers, our hospitals with 24/7, and we increase dramatically the home office capacities of hospitals, of insurance companies, and so on. All of them weren't used to do home office working in the past, and that switched. And within a week or two, we dramatically increased that capacity. So thank you for listening.